My relationship with TDR started when I was doing my postdoc because I have written my first research project, where I had to show that I was able to develop my own ideas. So I've applied for TDR support and I got it. So it has been great. And the TDR support also has been the start in my career on malaria, because I've done my PhD on another topic. So that's really the start of a big, big story for me. Alors, TDR is a unique organization in global health because it provides support to young fellows, young in science, and give them the opportunity to develop their ideas, to develop their own research group, and to make their own route in science. The impact of TDR in my career has been great, has been important, because thanks to this support, I've been able to develop my own research group and to publish and to write my name as a scientist. And also have been able to work in Africa with TDR support. So that has been the start of a long story in science.
At the moment, my current job, I'm the director and CEO of the Tropical Diseases Research Center, which is based in Douala, Zambia. And that institution has a history, a long, long history with the WHO TDR, because it was created in 1975 with support from TDR. So it was run by TDR from 1975 to about 1982, when the Zambian government took it over. The institution was created out of the need to um, build the capacity of developing countries to conduct research in neglected tropical diseases. So at the time, most of the research in neglected tropical diseases was being done in European countries, but most of the burden of the disease was in developing countries. So the World Health Organization created regional research centers in developing countries, one of which was Zambia. And so that was the beginning of the institution which I work for now. And so initially the institution started with those neglected tropical diseases like schistosomiasis and malaria. But we have, over the years, um, transformed the institution to conduct research in diseases other than those, just in order to move with the times, because the disease burden has changed, and so we have had to change with time.
I started working with TDR since 1990. That's more than 30 years ago. I started as a scientist in their Field Links program, which is a program that links young researchers all over the world. Since then, I've worked in various roles for TDR. I've been in various technical committees of TDR, including the Scientific and Technical Advisory Committee, and more recently as chair of the TDR Global, which is a community of practice of TDR. I think the most unique about TDR is its unwavering commitment to health equity and using health research in order to address the huge burden of diseases of poverty and neglected diseases. It also uses health research capacity building so that developing countries themselves can really lead the health research that they need to address these problems. The other thing about TDR is that although it's half a century old, it has been able to embrace change and innovation. For example, CHI, which stands for Social Innovations for Health Initiative, has been able to promote and do research on the most effective community-based solutions that communities can develop and test. If I look back at the years and my relationship with TDR, it has certainly had a profound impact on my career. It has helped me develop collaborations across the globe, especially help strengthen regional centers of excellence for health research. So I really think that without TDR, I would not be where I am today. Also, because of the emphasis of TDR on implementation research, TDR has helped me gravitate to health policy and systems research to make sure that the health research findings and recommendations actually are put to good use, good policies, and actual action.
Eu sou Alda Maria da Cruz, pesquisadora da Fundação Oswaldo Cruz e atualmente diretora do Departamento de Doenças Transmissíveis do Ministério da Saúde do Brasil. O TDR foi muito importante na minha formação e na minha trajetória até aqui. Eu desenvolvi a minha tese de doutorado em imunologia de leishmanioses e, por essa razão, e pelo fato do meu projeto também ter sido financiado pelo TDR, eu tive a oportunidade de fazer o curso de imunologia aqui em Lausanne e também estagiar junto com o professor Jacques Douy no laboratório do TDR em Lausanne. E essa formação, né, foi muito importante para influenciar toda a minha carreira científica.